Welcome to Exercising Safely with Cancer. This video is designed to provide safety information about exercising with cancer and to support the Wellbeing Wessex Exercise video tutorials. The aim is that by the end of this video you feel equipped with the knowledge about when to perform exercise, how to adapt it to your medical needs, and when it is necessary for you to stop exercising and seek further medical advice. Exercise is planned, structured and repetitive physical activity that aims to improve or maintain physical fitness. There are many benefits associated with exercise, and they can be deemed as vital to supporting cancer care and alleviating the side effects of treatment. Such benefits include promoting bone density, managing fatigue, improving function, supporting mental health, fighting sedentary behaviours, improving sleep, improving quality of life, increasing appetite, and reducing pain. Various types of exercise are seen as safe for individuals with cancer to participate in. Note, they are often recognised as being low impact. But we will come onto the required precautions and adaptations needed when exercising with cancer shortly. Types of exercise seen as safe include walking, swimming, tai chi, yoga, strength, balance and cycling. When to exercise. Exercise has been established as safe before, during and after receiving treatment for cancer. Exercising before treatment allows for pre-treatment conditioning, often making the journey after treatment that little bit easier. Exercising during treatment begins the fight against sedentary behaviours early and supports the maintenance of an active lifestyle irrespective of disease stage, but with respect to your condition and its side effects of treatment. Exercising after treatment has aims to improve quality of life and gets you back to doing the things that are important to you. You should aim to exercise for at least 30 minutes, 5 to 7 days per week, or complete 3 to 5 minutes of exercise several times a day, 7 days per week. And perform strength and balance exercise on at least 2 of those days. If you're going to undertake exercise, it is important for you to recognise when to stop exercising and when to seek medical advice or attention from your physiotherapist or doctor. You should stop exercising if you experience shortness of breath, dizziness or nausea, sharp pain in a specific area, new or increased fatigue or weakness, new confusion, sudden breathlessness, unusual breathing, changes to your vision, chest pain or palpitations. Before you exercise, you should know the answer to the following questions on the screen, so you can appropriately modify the exercise in which you are going to undertake. If you do not know the answers, please seek advice and answers to these questions from your physiotherapist or doctor. Are you neutropenic, a low white blood cell count? Are you anemic, a low red blood cell count? Are you thrombocytopenic, a low platelet count? Do you have bone disease? Are you likely to fall? Do you have an infection or a fever? Do you have peripheral neuropathy? Do you suffer from fatigue? These are some adaptations to make when exercising with the following. If you have changes in blood cells through neutropenia, anemia or thrombocytopenia, you should avoid high intensity activities that require lots of oxygen. Avoid activities that increase the risk of bacterial infection, such as swimming in public pools. Avoid activities that increase the risk of bleeding, such as high impact sports or high resistance training. And you should keep to light, moderate intensity exercise. If you have a fever above 38 degrees, you should avoid high intensity exercise and should be medically investigated before undertaking exercise. If you suffer from ataxia, dizziness or peripheral neuropathy, you should avoid activities that need considerable balance and coordination and incorporate balance and coordination exercises into your rehabilitation. If you have suffered a severe loss of body mass, you should avoid high impact activities and incorporate low level strength work to increase your lean body mass. If you experience dyspnea or shortness of breath, You should have investigations to identify the cause and how much you can exercise. If you suffer from bone pain, bone metastasis, or have bone disease, you should avoid high intensity contact activities that increase fracture risk. If you suffer from nausea, it's worthwhile having investigations to identify the cause, if there is any appropriate treatment, and what your exercise tolerance is. If you suffer from extreme fatigue, you should avoid high intensity exercise and exercise to your tolerance and not beyond. If you're currently receiving chemotherapy, avoid exercise on the day of chemotherapy. Have an awareness for your PICC line and have an awareness for any late effects or cardiotoxicity. Some further general safety tips include: avoid public gyms and swimming pools, minimise falls risk, avoid lifting heavy weights, wear supportive shoes, wear well-fitting clothes, clear your exercise space, pace yourself and listen to your body. You do not need to push yourself. Some further exercise resources include Wellbeing in Wessex, Myeloma UK, Blood Cancer UK, Macmillan Cancer Support. If you'd like further information, these are worthwhile looking up and having a look on Google and having a read through the information they provide. And finally, it's important to say, if you do not feel like exercising today, that is okay. Receiving cancer treatment is a challenging time and can bring about many side effects that leave you not wanting to exercise. The hope is that through this video and the exercise tutorial videos, you feel equipped to do what you can when you can. Thank you for taking the time to watch this video and enjoy having a look at the exercise tutorials.